Could I just begin by asking Dr. Bird, is the built environment important to the development of children and young people?
Thank you for inviting us. Yes, and as you can imagine, and it is increasingly vital as the research is coming through, and particularly, and we'll be talking a lot about the play and the other aspects, but the actual environment itself, what we now know, and particularly green space, has a major effect on the child's development of their brain and their health later. So starting with maternal, so mothers who live near green space in a built environment that's well suited actually have healthier babies. They have healthier weight and they have less preterm delivery. Also children, their brain develops differently. The hippocampus, the working memory, that part is larger in children who live near a green space when you adjust for everything else compared to children who live away from green space. And we know that air quality also has an impact on the brain's development. Not only that, it gets unfortunately slightly worse in that the telomeres, the end of the chromosome, which decide how long we're going to live and what diseases we're going to get for later life. The longer they are, the better. Children who live near green space have longer telomeres than children who live away from green space, everything else accounted. That means by the time we get to 18, they've got short telomeres, they're starting in a massive disadvantage and they will die earlier and they'll have more diseases. And we find it very hard to get those telomeres to lengthen up again. We can do it, but it takes time. Children's ADHD and other mental health, depression, all obviously connected to that green space. And we now know that the brain changes again because of chronic stress is buffered by the green space. And this seems to be far more obvious in children who are from deprived communities, where they're obviously getting a lot of stresses from other areas. So we seem to find that this reduces inequality of health. So the more green space you put into an area, the more your inequalities of those health of children will actually come through. And then finally, the obvious ones probably is obesity and physical activity, and it's probably the more obvious one that you get that. One thing I will just say is that children, we try to keep them clean and we try to keep them indoors because we think that's safe. But actually our bodies are designed to get bacteria from the outside. And children who play out in parks and green spaces and outdoors will pick up bugs which are absolutely essential for our development and our gut biome. And these are the bugs, the only things that can do it will moderate our immune system for the rest of our lives, because once we've got those bugs in our gut biome, they stay there. And that stops this chronic inflammation. So you get less asthma, less eczema, less hay fever, less inflammatory bowel disease, less in future cancers, dementia, heart disease, and all the other things connected with inflammation. So when you ask, is it important? I'd say it is absolutely vital that those 2,100 children that turn 18 today, they're now adults, and we've lost them if they have had a really poor environment because they haven't got those health attributes to take forward.
Right, I found that quite amazing actually, about that degree of scientific backup you've got for what you were saying. And is there, is it? I mean,